Every year, 1 million babies die on the day they are born. With proper care, 80% would live. Proper care includes neonatal resuscitation in the first minutes after birth. 10% of all babies need this time-sensitive intervention or they will not survive. The U.S. is not exempt. Black infants die at twice the rate of white infants.
Now we look at how the coronavirus outbreak is affecting soon-to-be mothers. Nearly 1 million women in the U.S. are expected to give birth in the next 3 months.
Pediatricians must carefully don PPE before entering the room to save a newborn's life.
We want his life to mean as much to as many people as possible and to let all of the positive ripples of his life be there.
Lives are being lost, but we are here to offer a glimmer of hope. Breath, a smartphone application that provides real-time guidance to healthcare providers as they resuscitate newborns. Whether you are a labor and delivery nurse alone when the baby is born, a midwife delivering a home birth, a provider in Pakistan trying to save a baby, or an EMT called emergently to a delivery. The Breath app was presented as a project for the UCSF COVID-19 Hackathon. 6 incredible people volunteered for our team, bringing a wealth of skills and experience. Software development, user interface, back-end development, 911 dispatcher, obstetrics, marketing, and project management. We held virtual Scrum meetings every other day to discuss accomplishments, roadblocks, and plans. We effectively collaborated with team members in multiple states and countries. We tracked our progress and iterated on features while collaborating between meetings via Slack. Using lessons learned from prior feedback for our prototype, we started from scratch, developing and implementing a cross-platform application that runs on Android, iOS, and the web using the Flutter framework. With clinical guidance, we successfully implemented the entire resuscitation algorithm. We included key features identified during the prototyping phase, the code timer, voice prompts, and media demonstrating the correct intervention. We also developed and deployed a REST API to collect de-identified resuscitation metadata to better understand pain points and usage patterns. And now here's a demo of our MVP, with the proud potential for 12 language options built from the ground up during the hackathon.
आप मतलब baby
क्या बच्चा सांस ले रहा है?
شيء أمودي يمي.
ماشوم سا أخلي كنا.
Is the baby breathing? If the baby doesn't start breathing soon, you will need to give breaths. Is the baby still having trouble breathing? Start PPV. Lift the chin, place the mask, and give breaths. Breath, and breath, and breath. Can you see the chest rise with each breath? You are not getting chest rise. Using our integrated app and database, clinician researchers will have access to never-before-seen information. This data will open a door, enhancing our understanding of the first minutes of life and saving babies. Additionally, the app can be deployed immediately to train UCSF students and residents during the COVID pandemic. As we continue to focus attention on the institutional racism and bias that has led to disproportionately poor outcomes for Black and Brown families, Breath provides an opportunity for improved, equitable care. The UCSF Hackathon has the opportunity to truly advance health worldwide through this technology. We hope that the Breath app will decrease neonatal mortality and the inequities that it represents throughout the world.